In this video, we're going to break down all the different kinds of hormonal birth control. Hormonal birth controls utilize synthetic hormones to control the body's natural cycles and prevent pregnancy. Typically, hormonal contraceptives prevent ovulation, thicken cervical mucus, making it harder for sperm to enter the cervix, or change the lining of the womb to prevent egg implantation in the uterus. Nexplanon, which is the birth control implant, is inserted into the arm and releases progestin into the body for 3 years. Deprovera is a shot which also releases progestin. It is injected into the buttocks or arm every 3 months by a doctor. The patch is worn on the lower abdomen, buttocks, or upper body, except for the breasts. The patch releases progestin and estrogen into the bloodstream. It's changed once a week for 3 weeks, and then on the 4th week it is skipped so that someone can menstruate. The ring releases progestin and estrogen directly into the vagina. It is inserted into the vagina, worn for 3 weeks, then removed for the menstrual cycle. Hormonal birth control is extremely effective at preventing pregnancy and can help regulate menstrual cycles and hormones, which can cause acne, weight change, or mood swings. In 2015, 70% of pill users cited non-contraceptive health benefits as reasons for use, and 7% of users stated use was exclusively for non-contraceptive purposes. However, hormonal birth control does not prevent STIs, HIV, or vaginal yeast and bacterial infections. Additionally, until the correct combination of hormones are found, there can be negative weight change and mood swings. IUDs, or intrauterine devices, are a kind of birth control that can be either hormonal or non-hormonal. The non-hormonal kind of IUD is made of copper. Overall, the IUD and implant are the most effective reversible contraceptives. This is because they do not require active maintenance, so their typical and perfect use coincide. Both IUDs are T-shaped devices which doctors surgically place inside the uterus. The hormonal IUD, also known as LNG IUD, releases progesterone to prevent pregnancy and stays in the uterus for up to 3 to 6 years. Its usual success rate is between 99.6% and 99.9%. The copper IUD also prevents pregnancy, can stay in your uterus for up to 10 years, and has a typical success rate of 99.2%. Additionally, if the copper IUD is inserted within 5 days of unprotected sex, it may be able to prevent pregnancy.